All right, hey everybody. So this is going to be your module 14 lecture video. We'll go ahead and switch over and get started. So module 14 is ankle and foot. Kind of the same information to begin with as before. You don't just kind of be aware of these bones and bony landmarks. There won't be any specific questions over these in particular. But you just need to make sure you still kind of remember so that you can treat properly, know the joints, know these different arches, kind of moving on. Make sure you know alignment problems that you will see in the ankles, valgus or varus ankles, and supinated or pronated foot, like the bottom of the foot. And then once again, you don't need to know every single one of these muscles. You do need to know them in their groups. Like, okay, this is a plantar flexor. This is a plantar flexor. This also is a plantar flexor, although a weak plantar flexor and a weak knee. So just kind of know which groups they are and how you would treat those, because in Therex, we treat in groups for the most part. And then make sure you know your special tests. There's only one really, and just the different actions and which muscles perform those actions, and the nerves are good to know as well. So moving on, some just common pathologies. We've talked about compartment syndrome before, but it's just where these compartments in your lower leg, right? So you have an anterior compartment, a lateral compartment, a posterior compartment. This posterior compartment is where you have your soleus and gastrocnemius. The anterior compartment contains tibialis anterior, right? And so what happens in compartment syndrome is, for one reason or another, fluid begins to build up in this compartment, and it gets stuck there and trapped there, and the leg swells and it gets super painful. It can cut off actually blood flow of, these are arteries and veins that carry blood to and from the heart and to the rest of the body. And so fluid will just keep building up and building up and building up. It can get really painful. There's two different causes. One is some type of crushing injury that damages one of these compartments and lets fluid start building up in it. Another one is if the muscles in a specific compartment get too big too quick and the compartment doesn't have time to stretch. Sometimes you'll actually see this specifically in people who are taking steroids. Those muscles will not allow that fluid to flow because it's too tight in the compartment. So anyways, they have to come in and they have to do this right here, okay? So they cut and let all that fluid out, and then slowly, as everything kind of gets smaller again and goes back to normal size as the inflammation goes down, they'll kind of just slowly start stitching this back together. But it's a really painful, really gross process. I've actually never seen a patient with this, although I did have a friend who had it. Achilles tendon rupture and repair. This is a fairly common injury, especially in people who play sports that are jumping sports, where they have to jump up and come back down and land. So you'll see it in obviously basketball, volleyball as well, where you're coming down and bearing that full weight. Occasionally you'll see it in football, more often in like receivers and defensive backs and things like that. So it's kind of a long, complex approach to it. They have to, but it's getting better. When I went through this course, it was a way longer process. They would cast it in all these different positions, but that has changed. So just make sure you kind of look over this and are aware of the treatment process for that. And there's two different ways, just so you know, to approach this. If it's not a really deep, full tear, they can kind of go with a conservative approach, or there is a surgical approach, and you kind of need to know how to treat both. And so here's some videos on how it is to deal with a surgically repaired one. Ankle fractures, very common fractures that you will see that you'll have to deal with. The good news is you're for the most part, you're not dealing with somebody until they're ready to start moving. They've moved out of that acute phase and are ready to start weight bearing, or if you get them before that, they might not, and so this will kind of walk you through how to treat that. Sprained ankles, really common, pretty straightforward treatment. If you have any questions over it, let me know. Plantar fasciitis, this is inflammation of this fascia along the plantar surface of the foot. If it gets bad enough, it will start to tear and cause really a lot of pain. I actually had a mild case of it, and even that was pretty painful. It's because I have flat feet and excessive weight. So two of the risk factors I've got. So you just kind of know that this is something you will see commonly, so you want to have an idea on how to treat it. If you have any questions over what exactly that looks like, let me know. Here's a good video on treating that as well. Shin splints, this is an overuse injury. It's actually caused by the strain, and it's really kind of a muscle pull, and the strain of it pulling against the shin and the bones. It's just a really like an overuse injury. It's a lot like medial epicondylitis or lateral epicondylitis, golfer's elbow or tennis elbow. And it's caused, you see it a lot in runners, and it's pretty preventable if you have the right shoes and with good support and good arch protection. You don't see it as much, but I've also had this because I don't have arches. Here's some good videos on treatment of that, but you can get it in the posterior, just kind of to the medial and back side of the shin, but most often it's anterior along tibialis anterior, and it's caused by just inflammation and pain in tibialis anterior. It's kind of a pull or just an overuse type injury, like I said. So you can look over those. There's treatment for anterior and posterior shin splints. If you have any questions over that, please let me know. Moving on. These are just minor precautions. Basically, be aware of weight bearing for whatever patient. Like I've taught you guys, if it's a surgery, the surgeon will send you with, if it's precautions. If it's a broken bone, they will send you with precautions. Even if you memorize the precautions from the book, guess what? Different surgeons have different precautions at different times, and so while it's good to have a general idea, you don't want to get married to those specific precautions from the books because they change. Moving on, bracing. There are different types of braces that you will see. This is just a Bledsoe boot to kind of protect it. Ankle injuries or bad ankle sprains, even sometimes fractures you will see with a Bledsoe boot. There are step stretchers. These are good for stretching out both tibialis anterior and tibialis posterior and the gastrocnemius and soleus. Arches, orthotic arches, I have these. It would probably do me good to get like professionally made ones. A passive night splint, you'll see this with people who have a problem with pointing the feet too much at night. Sometimes people who are developing contractures because they keep their feet in a pointed position all the time, but this is a way to just get that foot in a good neutral position. Some different foot strengthening exercises, towel curls. Put their foot on a towel and have them pull the towel towards them. Toe pulls is what these called. Wrap a rubber band around the toes and have them try and spread it. You can have them pick up marbles. Balance activities are really good for ankles. So dynamic stepping up and down from things are great ways for strengthening. Burpees, are, I don't know, lots of people hate them, but they can be a very good way to move to progress to strength. Just be careful with the jumping part of it. Um, and you have karaoke or karaoke, just threading. So many people call that threading, where you cross the legs and step to the side. Um, so anyways, these are just some different things you can do to treat and stabilize the ankles, besides some very straightforward ones too, and that's it. So I'm going to stop here, and if you have